Hello, everyone. Welcome to the Cancer Doctor podcast. Today, we're speaking with Dr. Linda Isaacs. Dr. Isaacs is a graduate from Vanderbilt University School of Medicine, and she's certified by the American Board of Internal Medicine. She offers individualized nutritional protocols for patients with cancer and other illnesses out in Texas, where she practices, as well as providing other protocols for health maintenance for the patients that see her. Dr. Isaacs, thank you for joining us today. We really appreciate it.
Well, thank you so much for inviting me. I'm glad to be here.
You know, Dr. Isaacs, you agreed to come back and speak with us about the topic of coffee enemas. You had written an article regarding this topic that was published in Alternative Therapies back in May, June of 2021. I read the article a couple of times, and I have found the discussion about coffee enemas quite fascinating. I've never used one myself, so I don't have any practical experience. But because there are so many individuals that are incorporating this as an adjunctive form of therapy when they're going through cancer treatments and whatnot, I thought this would be a perfect opportunity to speak with you about it because, as I understand it, this is something that you have more than 30 years of experience with. Is that correct?
Yeah, that's correct. Either doing them myself or recommending them to patients. I do have a lot of experience with them.
Perfect. So, for the benefit of our audience that are, especially the ones that are hearing about this for the first time, what specifically in layman terms is a coffee enema? Because when I think about coffee, I think about drinking it. But when you start
hmm
telling me about using it as an enema, there's all kinds of things that come up into my mind. So explain that to us, please.
Sure. Well, just to give you a simple definition, an enema involves introducing liquid into the anal area, into the rectum, and it's held there for a certain length of time. And coffee is, of course, coffee. Now, typically, coffee enema coffee is weaker than drinking coffee, and obviously, it's not boiling hot. You want it should be a nice, comfortable kind of temperature, not hot like drinking coffee is hot. So that's a coffee enema.
Okay. When you talk about holding this inside, of your body, when you introduce this, how long are we talking about? Is this something where when you do this procedure, is this a 30-second thing that you do, or is this taking longer than that?
It's taking longer than that. Typical directions will call for holding the coffee for 10 or 15 minutes. And the reason behind that is that the coffee enemas are not really about clearing stool out of the colon. Any enema will do that, and they're used commonly in the regular medical world for exactly that, for constipation. But what we believe is happening with coffee enemas is that the caffeine and other stuff in the coffee gets absorbed across the wall of the intestine, gets into the bloodstream that goes straight up to the liver and can have an effect on bile flow in the liver and gallbladder. So for that process of diffusing across the wall of the intestine to happen, you just need a little bit of time. So we're talking about 10 minutes, roughly. That's what
Okay.
most directions call for.
Okay. So through this process of absorption through the intestinal wall is what you mentioned. How is this benefiting somebody that's going through cancer treatments? What is the direct benefit? At least the speculation or the theory behind this.
Yeah, the main belief about it is that it stimulates the liver to process waste materials more efficiently. What we know for sure is that it does stimulate bile flow. And I say that because some investigators in Thailand, about 10 years ago now, actually did an experiment. They were looking at a procedure that involves swallowing a little bitty camera into the stomach and then through the intestinal tract. And this is done when you're trying to visualize the small intestine in small places where a scope can't get to. So the problem with this capsule swallowing business is that many times that capsule will stimulate bile flow, and then that bile clogs up the view, in effect. So what they did was they had some people swallow the capsule as per usual, but they had other people do a coffee enema and then swallow the capsule. And what they found was that if somebody did a coffee enema first, there was no bile to occlude the view from the camera. Conclusion, coffee enemas stimulate bile flow, which is actually something that's been speculated for in the territory of 100 years. But these physicians in Thailand actually did an experiment and showed it.
What is bile in the human body doing for us as people? What's its purpose?
Bile has several purposes, but for the purpose of this discussion, bile is where the liver gets rid of waste. The
Right.
liver is the main organ that processes waste materials. It actually will chemically alter them and then put them into bile. And then bile gets released into the intestinal tract and makes its way out. So what we believe is that the coffee enemas facilitate this whole process, move it along in effect, make it more efficient. But on a purely practical level, almost all of my patients feel better when they do them. They don't believe it until they try it, but just about all of them come back to me and say, I did not believe you, but the coffee enemas have become my favorite part of the protocol that you offer.
So I'm processing this, everything that you're saying. It's fascinating to me because you started off by saying it's going to promote the removal of waste product. And when I think about a cancer patient that is going through cancer treatments, and let's just say killing all these cancer cells, and I'll call it debris at this point that's circulating through the body or attempting to get out. I'm thinking of a solid tumor here. When somebody might be undergoing chemotherapy, the tumor is shrinking, but the question has to be asked, where is it going or how is it getting out of the body? It's my understanding, and once again, correct me if I'm wrong, but there is a condition called tumor lysis, I believe,
Mhm.
that if there's too much debris from this die-off from cancer cells, that it can cause a problem for the patient. So my first question, is that correct, what I'm stating? And then secondly, could coffee enemas help reduce that load so that the patient doesn't go into tumor lysis possibly?
Okay, so strictly speaking, tumor lysis syndrome, that phrase is used in the medical world for a very severe form of what you're talking about, where the waste materials from a cancer can cause damage to the kidneys, to, a lot of different
Mhm.
bodily functions. And so, your typical oncologist would frown on you, throwing that phrase around. But
Right.
having said that, I certainly think that given that tumor breakdown products can cause a very severe reaction, milder reactions could theoretically happen as well. And certainly many of the symptoms that patients can get from cancer, such as just fatigue or poor appetite, flu-like symptoms, things that are similar to when you've got a really nasty cold or flu. You feel achy, you feel tired, you don't feel like doing anything.
Mhm.
Um, that's also common with cancer. And what we believe is that that is a very low grade version of that tumor lysis syndrome. That's also the types of symptoms that coffee enemas seem to really help with.
Interesting. Yeah, kind of as I think about it, when I think about debris, I just think about stuff that doesn't belong, right? And I can only imagine the kind of debris that the human body's possibly accumulating when you're going through cancer treatment and all. And so it's difficult for me to not conclude that a coffee enema would be beneficial for the patient, right? Just kind of overall. Am I tracking with you? I mean, is that really what we're talking about here? Let's reduce debris load because it's better for healing and well-being and just kind of feeling better overall.
Well, I certainly agree. I've been recommending them to patients for many, many years. I do feel like, though, that just kind of for the record, I need to say, first of all, I wouldn't recommend just diving into it on your own if you're a cancer patient, and especially if you're getting treatment for cancer. It's something you need to, to bare minimum, do some research and talk to the doctor that's doing the treatment. Some of the folks that administer chemotherapy would say that you shouldn't do it while you're getting the chemo because then you're encouraging
Mm.
getting rid of the chemo itself. But I'd say that
Hmm.
typically there's a window between treatments and that it could be useful in that window. In other words, people might get say, treatment every 3 weeks. Well, you wouldn't want to do the coffee enemas right around the treatment, the chemo, but you could do it in the 2 weeks in between. And then finally, there are some medical conditions where it's not a good idea to do them. For instance, people that are needing to take diuretics because they're fluid overloaded, people that have problems with their colon, people who are very prone to infection, possibly as a result of treatment. So there are some medical situations that would make me say, maybe not the best idea. So I'm not giving you a blanket endorsement that every viewer of this video should dive in and do this, but I am saying that they can be tremendously valuable in the right situation.
I'm so grateful that you mentioned that. So, obviously, like anything else, you have to contextualize what's happening with the patient.
Right.
But so what I'm hearing you saying, even some conventional oncologists, though coffee enemas may not be something they're endorsing per se, they wouldn't want it done while the chemo is being administered because it may get rid of the chemotherapy in the body, right?
That's a theoretical argument that I sometimes get. Personally, I doubt if it's terribly valid, but at the same time, why patients will have to figure that one out for themselves. But I personally I don't think it's really practically valid. But on the other hand, if it's a concern for somebody, rather than worry about it, I'd say just skip it for a few days.
Got it. Okay, that makes sense. And I definitely want to hit, just for anybody viewing this, there's three categories of people that should probably stay away from this. Those that are on diuretics because they're dealing with a lot of fluid. Not a
Mhm.
good idea for them. Not a good idea for people that are having issues with their colon.
Right.
And not a good idea for patients that are prone to having infections. Did I cover that correctly?
Yes, and that last one is about infections. It's a theoretical argument, but honestly, a coffee enema done properly is no more stressful than having a bowel movement, and certainly nobody's going to tell you to stop doing that. So I think they're really quite safe.
So outside of those individuals that ought not to do it, are there any other possible side effects? In other words, those professionals, let's say the professionals that are out there. I think it was, I'm looking at your article here, it's in front of me. I forget which journal it was, but one of the journals that you had cited in your narrative didn't want these done. The Lancet of Oncology back in 2019, they weren't a big fan of this. But what are some of the reasons why those that do not think this is a good idea, what do they come up with? And is it just speculation as well? They're just poo-pooing it? No pun intended.
Well, what I'd say there is that, coffee enemas, it's an older, I mean, they've actually been around for a long time, but it's kind of an old-fashioned concept. That's the sort of thing they might have done in medieval times, you might think. But the Orthodox medical community, has people that are rather violently opposed to anything that comes from outside of what they recommend. And
Mm.
they have published various case reports of patients that have had bad outcomes that they've then blamed on the coffee enemas. So if you visit Dr. Google on the subject, or if you go to Wikipedia and read up about coffee enemas, or if you find that Lancet Oncology article, they're going to talk about individual cases that were published in the literature that describe, death by coffee enema kind of thing. And what I have found when I've gone to look at the actual articles that were referenced by those folks is that the patients described are people that were very, very sick. So the idea that the coffee enema killed them, as opposed to just the fact that their cancer was getting worse, is really hard to clarify. In other words, there are reasons why these people were on the verge of death besides coffee enemas. It's not like a perfectly healthy person took a coffee enema and then died. There's no cases like that. And there are a few cases where people burned themselves, but as I comment in my article, that kind of complication can be prevented by using a thermometer or some common sense. The way I approach it is that I just stick my finger in the coffee enema liquid, and if I can't leave my finger in there, I shouldn't put it in my body. But people do all kinds of strange things, and then those stories get written up as if coffee enemas are
Mhm.
dangerous. Well, putting boiling hot
Mhm.
coffee in your body is not a good idea, bottom line.
Yeah, sure. I mean, drinking boiling hot coffee is not a good idea either. So it's just common sense. And at this point too, I just want to mention for anybody that might be viewing this, because of what Dr. Isaacs is describing, she's giving a context to these individual cases. We had a discussion, Dr. Isaacs and I, about case studies and the value of a case study and the fact that they have to be contextualized to really interpret what is taking place with a patient. So it's not a good idea just to kind of read something and then make a conclusion that this is what happens to everybody, right?
Exactly.
Because the story does have its has its own specific context, and that's crucial. So for any of you that have a diagnosis with cancer, please do yourself a favor. Do not run with a conclusion that's made off just one story. At least at bare minimum, understand all the ingredients to the story and what took place with the patient and as to what determined that outcome. In this case, somebody getting burned with a coffee enema, for example, it was just too hot. That's not why. So please keep that in mind. Um, and also, Dr. Isaacs, you mentioned, you're not recommending as a medical doctor that people go run out and start, practicing on themselves, but they should probably get some professional help and some coaching because I would assume that this is not something your average physician is maybe experienced with. I don't really know. Uh, who would they go to? I mean, do you go online and you look up doctors that can train me in doing a coffee enema? Where do they go? Obviously, you're a physician and you do them. You personally have experience, but where would they start? Is there even a legitimate place where they could look this up to get more help?
That's a tough one to answer because, I know what I do, but I don't know where to send people that aren't my patient. So I'm not really
Okay.
sure. I mean, I think that any physician or any practitioner really should be able to advise them, that would be a really bad idea, and here's why, or I think that would be okay. Because the general reasons why a person shouldn't do a coffee enema are really pretty much the same as for any enema. And enemas are a
Mm,
common medical procedure. But in terms of
okay.
practical help getting started, I don't really know that I can answer that because, well, I don't know that I can answer that.
That's fair. Fair enough. We just want to make sure that, again, for anybody that's viewing this, it's thinking about proceeding. Do your homework. Do some look into this carefully and find somebody that appears to be legitimate that you could team up with in order to get a little bit of an education before you proceed with something like this. Because obviously you want to have a good experience and not a bad experience in the process itself. Um, so question regarding this, I'm thinking, I mean, when it comes to coffee, is this like the same kind of coffee that you use for drinking coffee, or is it a special kind of, I don't know, brew? I mean, what are we talking about here? Is it Starbucks? Is it Dunkin' Donuts? What are we using with this coffee? I just got to
Right.
know. I'm itching to know
Yeah.
the answer to this.
Sure. Well, with the coffee, bearing in mind that nobody's done a randomized double-blind study about all of this,
Hmm.
but what most people
Hmm.
recommend is that the coffee be prepared as if you were going to drink it. In other words, you've got boiling hot water, you've got your coffee grounds. There are some people that advocate a more typical roast, like typical drinking coffee. There are some people that advocate a green coffee. It's a lightly roasted coffee. My practical experience is that it doesn't make a whole lot of difference. There are a few people that seem to passionately prefer the light roast coffee, but for most people, it's all, six of one, half a dozen of the other, so to speak. It's all the same. I personally prefer the regular roast because the light roast coffee smells really weird. And while oddly enough, I don't drink the coffee, but I like the smell of it. So I prefer just regular organic coffee is what I recommend. It is weaker than straight drinking coffee. You water it down to make a more dilute solution.
So it doesn't necessarily have to be some specialized type of coffee bean per se.
Um,
It's really a matter of if you want to use something more mild, something stronger.
Yeah, I don't think that makes a whole lot of difference personally. I mean, I
Okay.
know that there are
Hmm.
folks out there marketing coffee that would disagree with me, but I find
Hmm.
that, if it's a stronger coffee, just add more water. It's not
Hmm.
complicated.
Yeah, and on that note, and I'm not speaking for you, but you mentioned marketing. I do want to speak again to all the cancer patients that might be listening to this, that there's an enormous amount of goods or services that are going to be marketed to you, that this is the best thing and this is the only thing that you should be using. Dr. Isaac is speaking from a professional, point of view as a medical doctor, and so I think that's valuable. And I think that you should take precautions when someone says it just has to be this particular product that you
Mhm.
have to use in order to get a particular outcome. Be careful, with that type of thing. Look into it, and this is why connecting with a professional like someone like a Dr. Isaacs or someone else could be highly beneficial for you. Maybe it could save you money and grief and just a waste of time altogether. So, who who's credited with developing coffee enemas? I mean, as far back as we know, because I think you mentioned, I know in your article you mentioned these things have been used now for I think over 100 years. But who is getting the credit for this in the medical literature that we do have up to the present time? And why did they start doing it? What's the history behind this?
I would love
Was
to
it
know
cancer or was
why.
it something
I would love to know
else?
why people started doing coffee enemas. I actually think about that kind of thing a lot. Like, why would anybody get the idea to do that in the first place? But the two names that you frequently hear in connection with coffee enemas in the alternative cancer space would be Dr. Max Gerson and Dr. William Donald Kelly. But neither one of them invented coffee enemas. With the modern age, with the internet, and there's a lot of older books and medical books even that have been scanned and put onto Google Books. And so I was able to find references to coffee enemas going back into the mid 1800s. So they were doing coffee enemas back then. They described their use for poisoning or for shock, where people are basically unresponsive. So there were surgeons that talked about them as being critical for postoperative care. And that actually included, interestingly enough, one of the Mayo brothers that started the Mayo Clinic. I found a reference to a lecture he gave in the 1890s where he was talking about coffee enemas being absolutely essential. Now, one of the things that you thought your audience might be interested in seeing, you wonder, well, back in that era, they didn't really have plastics or silicone, some of the nice, soft medical equipment we have now. So, what did they administer coffee enemas with? Well, one of my patients actually gave me something that a relative of his had collected as part of an antique medical instrument collection. So here we have a tool that was used to administer enemas a couple of hundred years ago. I do not recommend using this now. We have better things to use. And so, here's an example of what would actually go into the body for the current era. So here's a little skinny tube made out of silicone. Here's its twin made out of latex rubber. But you can see that these are a lot more flexible and they're not very big either. So you can see compared to the size of my finger, they're actually a lot smaller. So these are comfortable and easy to manage and not nearly as menacing as that antique enemy equipment I just showed you. So, who do we give credit for? I don't know because the people that were referencing coffee enemas back in the 1800s, they weren't saying, as proposed by so and so. It was more like this is a common technique that we all know about, and I used it to treat this kid with poisoning. So that was more the context of the articles that I found.
It's so fascinating to me. When I think about history dating back to this time, and just to see you pull up that antique, I'm blown away that somebody was sticking a piece of metal up their rear end. I can't. I got no other way to say it. It just blows my mind, and I often think how, you know, how sturdy and hardy people in the past were, and the risks that they would take in order to get better. But obviously, they took these risks and they learned some things. And I think there's a lot to learn from history. But thank God that, yeah, things are a little bit more gentle today with, something made of rubber or silicone, et cetera. It just blows my mind. But you mentioned that dating back to the mid 1800s, this was being used for poisoning and shock. Now, I know we're in that area of, we're speculating or there's theories or what have you, because we have limited um, data. Okay. And I think data is important here. But at bare minimum, if they were using it for these things, then definitely there is a connection here with coffee enemas being able to get rid of waste product. Even in the case of poisoning and shock, that's a pretty strong endorsement. Again, it might be anecdotal, but they were using it for these things, and so it seems to me to be something worth looking into more carefully here.
Well, I certainly think so. And, again, they were widely used in the up until probably around World War II, a little bit after. They were really fairly widely used. And from my point of view, they were dismissed not because somebody did a rigorous study and said they didn't work. No, they were just dismissed because they went out of style, bottom line.
Hmm.
And so I think it's one of those things where, the medical world has done its best to laugh them into history, or to portray them as dangerous, and yet they persist. And I believe it's because they make people feel better. I know they make me feel better. I know they make my patients feel better. And I think it would be great to, someday be able to do a formal study to clarify why and to help get them back out of the dustbin where they belong. I think they're very valuable.
So I'm going to ask you a personal question here, because you've mentioned twice now that you do coffee enemas. How
Mhm.
frequently do you, as a medical doctor, perform coffee enemas on yourself just to make you feel better? And you could fill in the blank what feel better means. I don't want to speak
Okay.
for you about something so personal, but tell us.
Sure. Well, I actually started the program that I offer a long time ago because I got sick. I had worked in a biochemistry laboratory as an undergraduate, and I was very, very careless and stupid with chemicals. Add that
Mm.
to 19 years worth of secondhand smoke, courtesy of my parents who didn't know any better. They loved me very much, but they smoked. And the net result was that I wound up with a fatigue syndrome that started during my medical internship. And I was doing coffee enemas because they helped me function well enough to finish my internship without, damaging anybody. Because I felt terrible. So that was back in the era when, people had to keep these crazy schedules. They still do, but it was worse then. And sleep was desperately important, but I would still get up 45 minutes early to do those coffee enemas because that's what helped keep me functional. And I've been doing them regularly ever since. Just like I said, they made me feel better. And at this point, I can skip a few days. Like, say, I'm traveling to visit a friend, and I don't think I really want to explain to the friend why I'm going to be holed up in the bathroom for an hour. So I'll skip a few days and I'm fine. But overall, I just feel better if I do them. So I do them.
Fair enough. So I heard you say it's about a 1 hour commitment to incorporate this into your morning or evening or whatever that looks like.
Give or take. Again, it depends. If people can hold the coffee, they could potentially take care of some of their morning routine while doing that. I'll also throw in that sometimes people speculate like, oh, it's a caffeine high. You get the same effect if you just drank the coffee. That's not
Mm.
correct. First of all, I've tried it both ways. Again, during my medical internship, when I had to stay in the hospital for that 36-hour stretch, I would try drinking coffee because I couldn't go home and do the coffee enema, and it did not have the same effect. And
Mm-hmm.
also, some other investigators in Thailand actually measured the level of caffeine that you get from drinking coffee versus doing a coffee enema. It's a lot lower with the coffee enema. So no, it's not a caffeine high.
I'm thinking, I keep going back to the purpose of this is to remove waste product out of the body, which
Mhm.
sounds like a good idea if I could get waste product out of my body. And we're using coffee to do this. Has there been, or in your personal experience, have you witnessed patients using something else other than coffee in order to get rid of waste product? Like maybe even something as simple as just water, that's being used,
Yeah.
that's warmed up or what have you. Um, and if so, are you getting the equal results or no, you're not getting the equal results? What does that look like?
Yeah, actually, some investigators back in 1929 established that any kind of enema will stimulate bile flow from the liver and gallbladder. Coffee has an extra little kick to it, so to speak, because there's some things in coffee that have been documented to stimulate a hormone that then stimulates bile flow. So there's a little extra oomph with coffee. But I'll also say that there are a few patients who are extremely caffeine sensitive and cannot do the coffee enemas, and then will use other things. There, chlorophyll has been used, bentonite liquid, diluted, again, not just the straight out of the bottle, but diluted. So there are other options and they can be beneficial, but I think coffee has a little extra value.
When you mention these individuals that are they're highly sensitive to caffeine and they can't use it, what
Hmm.
happens to that individual? I mean, are they just producing their bowel movements just they lose control of them too much, or what does that mean? They're too
No,
sensitive
it's
to
more
caffeine.
that they get jittery. They might find that their
Okay.
heart starts just get beats. The same effect that your average person might get if they drank 5 cups of Starbucks.
Okay.
But for these people, they're
Hmm.
super sensitive, and even the minimal amount of caffeine makes them start having racing heart.
Okay. All right. That's definitely making a lot of sense. Now, as far as the equipment today for this, like it seems like it's pretty basic equipment. I mean, it's a hose and maybe a bag to hold some liquid plus the coffee. But just on the equipment, can you give us just on average, based on your experience, what the equipment costs to do this type of protocol at home?
It all depends on what equipment you get, of course, but
Okay.
the products that I recommend, I believe, come in for everything around $80. But
Okay.
though that's a fairly durable setup. You can A cheap enema bag can cost $5.
But even still, even at $80 or $100, that's a very small investment when you're talking about removing toxins out of my body and being able to feel better, right? There's many cancer patients that I've met over the years that they just don't feel good. And if there's something that can help them feel a little better, then maybe this is worth, more investigation on their part and giving it a try. So specifically the patients that you've worked with over the years, that have a cancer diagnosis, how frequently are you recommending to your patients to incorporate a coffee enema into their protocols? Is it a once a week, every day, multiple times a day? What is on
It,
average, what does this look like? I know
it's
cases vary, but
Yeah, they do a session in the morning and another session in the afternoon or the evening if it doesn't keep them awake. For some people, the coffee enemas will keep them awake. I know back when I was so sick, they would actually help me sleep to do
mm,
them. But my particular situation was really, I think, to a large extent, poisoning from the chemicals I'd used in the lab. But
wow.
yeah, a minimum of two sessions a day.
Okay. 2 sessions a day. All right. And that's 2 sessions a day every day. We're just talking an everyday type of, part of your everyday life.
Yep.
Okay. Fair enough. Now, I would like you to address something, and it was in your paper that you wrote, the article, and it's the topic of glutathione. This has come up before, coffee enemas, raising glutathione. If you could please, for our audience, Let us know just two things. What is glutathione in the body? What is its purpose? It is coffee enemas. Is there proof that coffee enemas increase glutathione or decrease it? Talk to us about that, please, just for a moment.
Sure. Glutathione is a chemical that the liver uses to get rid of toxins. So what happens is that the liver attaches the toxin to the glutathione and then puts it into the bile. So glutathione is a key product in detoxification. So having more of it available helps you get rid of waste better. Now, there's been a fairly persistent statement from the advocates of coffee enemas about how coffee enemas increase glutathione levels by a huge amount. But unfortunately, the evidence for that is really extremely weak. I'm not saying that they don't, because it hasn't been properly tested. But I am saying that the evidence chain for that is not good, because I traced it back to a particular article that was done, a study that was done, where they gave mice a diet that consisted of 20% green coffee beans. And those mice developed a big increase in the amount of the enzymes that make glutathione. And that's nice, but it really doesn't have anything to do with coffee enemas, because we're talking about feeding mice huge amounts of coffee beans. So you can't translate that over to coffee enemas, but somebody did. And then everybody quoted that person's article and said, coffee enemas do this astonishing thing with glutathione. But there were some investigators in Thailand that actually measured glutathione before and after coffee enemas. And then they said there was no statistical difference. In other words, they didn't see a big increase. Now, I'm getting very technical here, but I'm assuming that's what you want since you read the article. I'm not saying that they proved it's not correct, because the amount of coffee that they were having these people do as part of the experiment was way less than what I would recommend or what's involved with the Gerson program. So who knows, if they had done it properly. And another consideration is that you make glutathione, but then your liver promptly uses it up. So you don't know for sure what's going on, honestly. But so coffee enemas may have their benefit by stimulating glutathione, or they may not. All I'm saying is that when people start quoting 600 to 700% increase, that's all based on that mouse study where the mice were eating it. They weren't doing coffee enemas. So that's the glutathione story. The jury is out.
Thank you. And I just want to recap. Yeah, I get it. So, and I want to recap what you just said for our audience. So, glutathione is a chemical in the body that kind of operates like an automobile, which allows the body to drive these, we'll call it toxins, through your liver and get it out of the body. So glutathione is a good thing. It's a little car that's taking the trash out, kind of, right? But we really cannot prove, nor can we disprove, whether or not coffee enemas in particular increase glutathione in the human body. We just don't know. We don't have those kind of studies. We don't really have the data. If it's happening, fantastic. If it's not, it's okay. We're doing these coffee enemas to get rid of toxins, to move them out of the body anyway. Is that a fair assessment?
Yeah, I couldn't have said it better myself.
Oh, I'm sure you could have said it much better, Doctor. So now here's my next question for you, because this is something that is coming up with among cancer patients, something that they're evaluating as an adjunctive therapy. And it's something called colon hydrotherapy. It's also known as colonics. Can you explain to us what colon hydrotherapy is, or slash colonics? These terms seem to be synonymous to me. And what that is and why that's different from doing a coffee enema. That's one question we have that we're getting. And the next question is, can the colon hydrotherapy replace me having to do coffee enemas? What does this look like? Could you explain that to us, please?
Colon hydrotherapy, as I understand it, is something that is done. I mean, first of all, it's done to you. You have to go to somebody who will administer it to you. Whereas the coffee enemas, once you learn how, you can do that at home by yourself. And colonics involve introducing water into the colon under pressure. So it's going to be going higher into the colon and stimulating feces to be moved out of the colon. So it's different from the coffee enemas because the coffee enema is low pressure. The only pressure moving the coffee into your body is gravity. You've got the bag a little bit higher than you are, and the coffee naturally goes into your body. With the colonics, you've got pressure. So that's a difference. In terms of one replacing the other, on a practical level, Dr. Nicholas Gonzalez and I picked up this work from Dr. Kelly, our predecessor, because of a lot of good case reports he'd had, and he had people doing daily coffee enemas. So we moved forward and had people doing daily coffee enemas. There's no real way for me to quantify whether colonics would replace that. From my point of view, given comparing something you can do at home inexpensively for something that you've got to pay somebody else to do, I think that doing coffee enemas at home on a daily basis makes more sense.
And it sounds like you don't personally have any personal experience doing a colonics or colon hydrotherapy at all. It's not something you've ever ventured into doing for yourself.
Well, I have had one just out of curiosity, and it didn't sell me that I needed to tell my patients to go do it. I think
Okay.
I just don't think it's necessary, is what I'd say.
And I really respect that. I respect the fact that it's something that you tried out for yourself to see, is there some merit to this? And is it something I should be recommending? And you're like, well, I think coffee enemas is still probably better. It doesn't cost as much, and you could do it at home, and there's a level of convenience to all this. So I appreciate you giving us that commentary. It's really helpful. Is there anything else about the subject of coffee enemas that we haven't covered that we should know about? Because really, like, the last thing I keep thinking to myself is, should every cancer patient be doing a coffee enema, or is it, just kind of a case by case situation? Is there anything else you could tell us?
Well, I personally find that just about everybody feels better if they do coffee enemas. We live in a toxic world, unfortunately.
Mhm.
We're told that we've all got microplastics in our arteries at this point. We live in a toxic world, and I think the
Mhm.
coffee enemas help us deal with that. So, I've already given you the caveats about certain people that should
Mhm.
not do it. And I'm not prepared to, take responsibility for other people's decisions. They have to think through
Mhm.
it and talk to their own professionals about it.
Mhm.
But I think they're a fabulous tool, and something that can be beneficial to a lot of people.
One last question. As you know, we ask our last guest to ask a question of our next guest, that cancer doctor, not knowing who the guest is going to be. And so there's a question that somebody has left for you. And the question is as follows: what is one professional disappointing experience that you've had that you've learned a great deal from?
One professional experience that I've learned a great deal from.
That was disappointing to you?
That was disappointing. Yeah. You know, I haven't had a whole lot of disappointing professional experiences, perhaps partly because, like many doctors, I'm a terrible patient. I don't tend to go to doctors very much. Overall, I've really been fairly satisfied with medical professionals. Now, I could say a few things about legal professionals. That's a whole nother story, but they're still professionals. And what I would say there is that that it's important to go ahead and speak up. if you have any questions about how things are going, say something. Don't be shy about it, even though it's not your area of expertise. So that's what I would say I've learned from experiences with professionals, although not necessarily medical ones. I have no problem speaking up with medical ones.
Perfect. Okay, thank you so much. Now, if anybody wants to contact you directly, is the best way to do that through your website?
Yes, I would suggest that people visit my website, which is www.dr, like doctor, drlindai.com. So visit my website, look it over. I've tried to be thorough about what's involved with what I offer, the costs, et cetera, et cetera. If you sign up for my email list as a bonus, you'll get access to all the different articles I've written, PDFs of those articles, one of which is the coffee enema article that we've just talked about. And there is a contact us form on there as well. But I think most of your questions will be answered if you just look around my site.
Perfect. Okay. Once again, that's www.drlindai.com is a way to get in touch with Dr. Isaacs. And I'll put in a plug. I'm on her email list, and the emails that she always puts out are right to the point, beneficial. There's good content there. And I consider them an email that are worth reading versus just letting them go into the trash. So I would sign up for her newsletter. It's wonderful. Dr. Isaacs, we really do appreciate you coming back to meet with us. We look forward to having another discussion in the future.
Happy to be here. Thank you.